at any time. Good morning, Dr. Seshni, and welcome to Coffee Break for this morning.
Good morning. Good morning, Opoku. How are
You're
you today?
muted, Dr. Seshni.
Oh. Good morning. Good morning, Opoku. How are you today?
I'm not too bad. It's scary. It's the 28th of February already.
I know. The end of February. I cannot believe it, honestly.
Yes, it's the end of February. We're going into March now. Gee. Can you imagine?
I know. Good morning. Well, good morning, Opoku. And thank you so much for having me on the show. And I'm really grateful to be on the show. How was your weekend?
Fantastic. It was really, really nice. Saturday, I went I saw a stand-up comedy show.
Laughter is the best medicine. I always say that. So what did you watch?
Well, there was 4 comedians. Absolutely amazing comedians, you know. There was one lady from South Africa. You might want to know that.
Yes, please. Go on.
Yeah, there was a lady. I forgot her name, to be honest. I know I'm naughty. I forgot her name. She's called... I forgot. I'll remember and let you know. But she was absolutely amazing.
Brilliant.
And then there was an Indian guy, British Indian, but from South London. He was hilarious. And then there was a Nigerian who was a compare. He was absolutely amazing. And then there's a 4th one as well. Yeah, we had a great time. I just laughed my ribs out.
I love that. Laughter is the best medicine. Sounds like you had an amazing time. And
I did have an amazing time.
Any restrictions in the comedy theatre or?
No, there were no restrictions at all. Of course, the people were sensible enough. Some wore masks, some didn't. Most didn't wear masks. But it wasn't like group hug and stuff like that. So it was okay. We felt quite safe.
So did you feel like it was quite getting back to normal, like living with COVID? That
exactly what I felt. Like we're back to normal. You know, the theater. It was a sold out gig, and the whole place was full. It felt good. So I loved it. I mean, I must let you know, I loved it.
I can see you. So we could just spend the whole show talking about that and just getting back to normality. You can see the smile on your face and how happy you were just doing something which you obviously enjoy doing. And, over this 2-year period, how, you've missed all of that, haven't you? We've all missed it.
Tell me about it. I've missed it. Yeah, but except that we're still being careful.
Yes.
That's
so. I'm so glad you said that. Yeah, go on. I want to hear why you're saying that.
We don't want to be complacent, do we?
No. Don't. And I'm 100% behind you, and I'll tell you a few reasons why. But before that, I just want to say I was in London, went with the youngest to the Light Centre in Croydon, and we were in the underground in central London. Mm-hmm. It was packed because I think there was some Liverpool-Arsenal match and there was lots of football going on, lots of protests.
Chelsea and Liverpool.
Oh, yes, Chelsea. I meant Chelsea and Liverpool. I don't know why I said. Why did I say Arsenal? I think I'd seen Arsenal somewhere, but it was Chelsea and Liverpool. So the train was packed, the underground was packed, and everywhere you went was really busy. So I couldn't believe why it was so busy. Whether it was just because of the football or was it there was something else going on. But in the underground, they did say that the TFL, the announcement was you need to wear a mask while you're on the subway, on the underground. But having said that, we were surrounded by people that were without masks. And we were like
next they were to shouting and chanting, weren't they?
I know. People were drinking and people were in close proximity. And we were like next to each other in the subway. There was no way in the underground. I keep on saying subway because I think America, they say subway. England, we say underground. But we were like next to each other, there was no space. And that's how it was for the train journey, going and coming, and the underground. And there were hundreds of people, and that's not a lie. And I was just looking, I mean, I shouldn't have done that, but I was just like, there were people around me without masks, and I was wearing a mask. I was feeling quite safe, though.
The only consolation I can think of, really, in that situation is the fact that if these people are football fans and they're going to the stadium, they would all probably have a negative COVID test. before they can go into the stadium. So,
oh really?
If that is a consolation, then that's it.
Yeah.
Because if they're around you and they are going to the stadium, they cannot go into the stadium without showing proof of a negative
Oh
test.
wow, that's a relief because yeah. So yeah, no, there were people like without masks, and I was just looking at them and just wondering, like some people are feeling really confident that they don't need to wear masks, they don't need to to have any responsibility, but it's everyone's choice, I guess. But myself and my youngest, we were wearing masks and we had it on the whole journey, only except when obviously when you're eating and drinking we didn't have the mask on, but all throughout, even when we were at the center, they still take your temperature, you've got a hand sanitizer, and you maintain social distances, restricted numbers to go to certain places, and even at the center. So, and we had our mask on the whole entire time. So it was a very pleasant, enjoyable journey, but at the same time, it's just interesting to see how now that restrictions have ended, how things are obviously going on in terms of COVID, and how people are, sort of managing it. Because, well, obviously they are following what they've heard from the government. They're going in accordance with that, and you can't blame anyone. So, yeah, I just wanted to share that before talking about the other issues. Yeah.
It's good you brought that up because talking about restrictions being lifted and all that. In Scotland, more coronavirus restrictions have been dropped, and secondary school pupils will no longer have to wear face coverings in the classroom, and they will be required in corridors. Why? I don't know. Anyway, the legal requirement on large venues to implement the vaccine passport scheme also comes to an end. The app will remain live, though, for businesses wanting to run a voluntary scheme. And all remaining legal coronavirus restrictions in Scotland, including the wearing of face masks, are expected to be lifted on the 21st of March. So Nicholas Sturgeon has said Scotland will move away from legal restrictions, relying instead on vaccines, treatments, and good public health behaviors. And it comes almost 2 years after the first confirmed case of COVID in Scotland was reported on the 1st of March 2020. At the end of the month, the UK was under lockdown. We know that. Well, so that's what's happening in Scotland. Yeah.
Well, I'm not surprised because we did speak about this, that obviously other countries and other places are going to follow in terms of what our government has decided. So it's about living with COVID, and I think obviously Nicola Sturgeon and the rest of other people and other leaders elsewhere will be doing similar things, slowly reducing and these restrictions and obviously the guidance. I just wanted to say, I'm not sure if you've seen the Hong Kong news. So there has been concern.
Sorry, you're kind of breaking. I don't know why.
Okay, I was just talking about the Hong Kong.
Yeah, what's happening in Hong Kong?
So in Hong Kong, there were 34,000 cases of the Omicron wave, and there's a concern that they could possibly go into lockdown. So this has come about in the last 24 hours. So I'm not entirely sure what's going on, but I think that's the latest news from Hong Kong. If we're doing like a global update of other countries, I don't know how that's going to impact other countries, but if we're hearing about it in Hong Kong, I'm sure we're going to hear about it in other countries as well. But that seems to be the.
Okay, we'll let's go to that. After we've sorted out what's happening here in the UK.
Okay. Sure.
Yeah. And there was an article on COVID in Wales. I think it's about vaccines. I can't find it now. I had it up my screen earlier on. Let me see if I can pick it up. Give me 1 second. Let me look for it.
So while you're doing that, there's still discussions about the sudden health that was in the news. To be honest, you're right. If you look at the news, there's not that much. If you look for the UK, last was like 4 days ago where they actually made all the announcements. But in terms of the sudden health, that still came up today, where there's still investigations into the positive testing and the false results that were given to up to about 100 people. so staff and people in the community and patients. So that's obviously still going to be investigated, and obviously still a concern. Because I think from anything like this, it's about learning. It's about finding out why it happened, and how to prevent it in future. Because obviously it impacted on those people's lives. Yeah.
Yeah, I'm seeing something here about a boost, an extra COVID booster. And they're saying that I think this news is not, it's been around for a few days now, and we haven't treated it. So I thought that maybe we can talk about it.
Oh, great.
That additional booster dose will be offered to all adults over 75 years and the most vulnerable over 12s in the UK this spring. So the UK's vaccines advisor said an extra dose will help top up their protection against severe COVID-19. And many of the oldest received their latest shot back in the autumn, and immunity may now be waning. It said, what does that mean? The immunity waning? Does that mean that from time to time we'll have to have boosters?
Exactly. It's like how we've had, the immunization schedule, and we have to have the flu vaccines every sort of year. It's the same thing, Opoku. So obviously, in terms of the COVID-19, our immunity will change as time progresses, as well as in terms of the mutation of the virus. The virus and the variants will change. So we obviously need to be getting immunity for that. And vaccines to help us prevent us getting that, and to be effective against those type of the variants, or the whichever type of COVID-19 it's going to be, as well as so the strain at that moment in time. So that is why we get the flu vaccine, because it every time there's a different strain. So it's very, very similar to understand. So I think most people will understand that point. But just going to the booster, I'm glad you brought that up, because the booster is currently being offered already. I'm not sure about the communities, but I know certainly in hospitals, it has been, some people have received it, the fourth booster. So people that are vulnerable, and in obviously the over 75 age bracket, and vulnerable people will be offered the COVID-19 booster. So it is something that is going to, it's already in effect, to be honest. So we will probably be hearing more about it. But as you know, so I mean, if you also look at how we've had the vaccines, Opoku, we've had the first dose, the second dose, and then we had to have the boosters. So most people would have had their boosters by now. I think by March, most people would have had all their boosters. So then looking for the next 6 months to a year, we'll then probably have a look. The government obviously will be looking at people having the fourth vaccine and the next booster.
So, this is what a lot of people predicted. What some people predicted, that we're going to be asked to have boosters all the time, like from time to time. We just need to top up and top up and top up. And I don't know where that's going to take us.
I know.
Yeah, but we've got to do what we've got to do anyway.
I think it will be similar. Exactly. I think it will be similar, like how.
Like a flu jab?
Exactly. That's what I feel. I mean, but in one sense, I want to say it's similar, but in another sense, I want to say it's not the same. COVID-19 for me feels like it's different to the flu. And I don't want to compare it to the flu, to be honest. But I think a lot of people are looking at that in comparison, like the flu and COVID, sort of similar. But if I look, for me as a doctor and psychiatrist, and look at the impact of COVID, compared to the flu, where we're at and where we are with COVID, it's two different things. But I think it's going to be, in terms of the approach people are going to use, it's going to be similar. So it's like how we get a notice from our GPs, from the health services, and people at work, professionals working in the healthcare sector. You get a message or an email or a text, or your boss telling you that you need to have the flu vaccine. It's time for that. It's going to be something similar, where people are going to be urged that if you're working in the health sector, or any person in the community will be offered the COVID booster. So it is going to be like that. And I think, yes, I understand exactly how you're feeling, Opoku. And I sense, obviously, the way you're feeling is going to be how a lot of people are feeling as well. Because I think we thought, okay, we were told we needed the first dose, second dose, and then the booster. And that we were happy with that, and we've taken it. But now we're told we need to take another one. So, well, let's see what the guidance is going to be. At the moment, they're offering it to the vulnerable, and then, but I think we had been warned previously that we possibly would need to take another booster, and there had been discussions a few months ago. So I think it's highly likely we're all going to be offered the booster, the fourth.
Okay.
Yeah, the fourth injection.
All right. Right. Should we go to Hong Kong now?
Yes.
And
sure.
Yeah. So if you tell us what you told us earlier on again, please, and then I'll add what I have here on my screen.
Yeah, sure. So according to the news, I mean, as I said, it's just come up today. But in terms of the reporting, is that what they are reporting is that the COVID-19 response team leader of China's Health Commission is arriving in Hong Kong, as well as there seems to be a surge of people trying to leave Hong Kong, and that's because the headlines is 34,000. So Hong Kong records more than 34,000 COVID cases, virus update. So somehow they've recorded a large number of cases on Monday. This is now reported. And so they're in the process of moving away from their COVID zero strategy. So they obviously had a different strategy. But it seems that they've now... They reported 34,466 confirmed cases on Monday, according to the health official Albert O, and who said at a briefing, the COVID deaths among people aged 51 to 100 stood at 87, and 49 patients were in a critical condition. So international schools were also, they were looking at schools taking a break. And I think another headline said that they might be heading for a lockdown. So it seems to be happening quite sudden, Opoku. I'm not, I'm sure you're feeling like that as well. So
a few days before that, they're saying that Hong Kong's government ordered the compulsory testing of all of its 7.5 million citizens as the city battles surging coronavirus infections. Chief Executive Carrie Lam said residents would have to undergo 3 rounds of tests starting in mid-March. Schools will break early for summer. The territory is trying to adhere to China's zero COVID policy, and the highly contagious Omicron variant has overwhelmed its hospitals and testing and quarantine facilities. While other parts of the world are learning to live with the disease, China's policy is to try to eradicate infection through early testing, detailed contact tracing, and strict quarantine and travel restrictions. Oh, I see. So I now understand why they would want everybody to test, and it's because China is trying to completely eradicate it. Like we are trying to live with it. We're saying that we're living with COVID, but they don't want to live with it. They want it completely gone. I see.
Well, and I think so. What they're saying is it's quite serious. Hong Kong has been hit and considers lockdown as bodies pile up. So we know that people there is some fatality, some people that have died, and the numbers are increasing. So Hong Kong may impose a China-style hard lockdown that confines people to their homes. So it seems that it is getting quite serious in Hong Kong, and as you said, 7.4 million residents were urged to test, and it seems to be very serious. There seems to be, what they're reporting is that the revelation adds fresh uncertainty and anxiety for residents and businesses in a city gripped by the kind of chaos and which was more familiar at the start of the pandemic. Hong Kong recorded now 193,000 cases and 636 in the current wave since December. So yeah, so obviously it feels like this is like Wuhan, China all over again, December 2019. But hopefully not, because obviously people have been vaccinated, but I think we'll have to just hear more about what's happening. But as you're saying, it seems to be, it is the Omicron variant. They have confirmed it's the Omicron variant. So which is surprising for me, because the rest of the world where we've had Omicron has not been that fatal. We've heard about Omicron variant, we heard that it was spreading faster, but most people that were vaccinated, and if they did contract Omicron wave of the COVID-19, people were having mild symptoms, so mild to moderate, and most people recovered at home. So we only had, percentages that went into hospital. So as you've just heard, so in terms of the psychological impact, Opoku, and as I was reading that, it said that the city, the residents in Hong Kong are gripped now with anxiety and with fears, in terms of what's going on around them, because they're hearing about the numbers going up, people are dying, and it's an Omicron variant, and that the country might go into lockdown. So it seems exactly what you said. The rest of the world is trying to live with COVID, but Hong Kong seems to have taken a U-turn. So I mean, I hope they do manage to get control of it. I mean, if they're doing mass testing, the most important advice is obviously mass testing, mass vaccination, and obviously adhering to guidance and lockdown. So from the past, times that we've had to go into lockdown, and from learning from other countries, that's the way it has been managed. So hopefully things are moving in the right direction for Hong Kong.
Hopefully, there's not really a lot to report on COVID today.
No,
there's not a lot.
Yeah, I was reading the news, and and in terms of the UK, you're right. Today is like the first day that they're saying that there isn't that much. But having said that, they're saying an Omicron BA2 variant has now been detected.
Yeah, I heard about that. Heard about another. So is it true that this particular variant of the Omicron is not as deadly as, I mean, it's even less deadly than the Omicron? Is it?
Well, we don't know. To be honest, I don't know. They're saying after months of the new Omicron being dominant in the UK, its close cousin has new coined itself as a new prevalent variant, according to the health experts. So, so it seems to be, they tell me that a cousin, it's nicknamed as stealth to the new Omicron subvariant, which has first appeared in parts of Europe and Asia, and also in Denmark. So, according to scientists from the UK HSA, Omicron BA2 now makes up 58% of COVID infections in the UK. Yeah, and this was dated in the last 7 days since the 20th of February. So 2 weeks before that, the COVID variant only for 19%. So it seems that this one. So I think what they're saying is, Opoku, my understanding is becoming the dominant variant. So this subvariant, or like a twin variant of Omicron, is now the Omicron BA2. But what they're saying, it's accounting for the most of the infections, at least 50% of the infections. So let's watch the space. But that seems I think what they're saying is it's more transmissible. They haven't commented on the lethality of this variant. And it would be interesting to see which type is in Hong Kong. And they say Japanese research has looked more into the variant and its severity. So the researchers they're looking at research into infecting hamsters. And then the findings from the researchers at the University of Tokyo suggest that BA2 could cause a more severe disease. So there's your answer. Yeah.
Okay.
But as you said this, remember when we first started talking about the Omicron variant in November, you remember you
Yeah.
said we're gonna hear about another variant. There's gonna be something. So
we said that, didn't we?
we did. So I think this is again living with COVID. It's about people. And I can hear people are saying, "Oh, we're going on about COVID again." But I think it's just about keeping yourself updated, having that awareness of what's going on, having that responsibility, as Boris Johnson said in his speech when he was talking about living with COVID and plans to end restrictions and end free test. He said we each will need to have that. Everyone needs to be responsible. We need to have that responsibility. So I think that's what it's going to boil down to. And you said it as well. So,
fantastic. Let's do the numbers and then we'll get out of here.
So let's do the numbers. I'm going to have to just refresh the page because it's been on a while, and hopefully we can then start with the numbers. So the cases globally as of today, the 28th of February, is 436,225,349 cases globally. Total number of deaths is 5,969,352. So we are reaching about 6. It's 5,969,352. So sounds like we are nearing 6 million.
Yeah.
Total recovered is 366,831,112 positive cases that have recovered. So the top 5 countries are USA number 1 with 80,567,757 positive cases. Total number of deaths 973,119. India number 2 with 42,924,130 cases. Total number of deaths is 513,843. Brazil number 3 with 28,768,104 positive cases with 649,195 deaths. France is number 4 with 22,689,332 positive cases with 138,135 deaths. So UK is still number 5 with 18,804,765 positive cases with 161,224 deaths. And we're going to South Africa, which is number 20, with 3,673,257 positive cases with 99,229 deaths. And Ukraine is just above that, number 19, with 4,809,624,000 and positive cases, and the number of deaths in Ukraine is 105,505. And then we've got Ghana, which is still gone to 111.
111, yeah.
With 159,124 positive cases, with 1,442 deaths. Are you having some travel plans to Ghana sometime?
Yes, I am. Yeah, soon.
Well, it seems to be under control in Ghana.
Yes, it is.
I know you did say you were leaving, so that's why I just asked. Yeah. And then in terms of the last 24 hours in the UK, we're looking at 31 million. The top figures, in terms of the cases, is 31,933 new cases with 120 new deaths. So that was the last 24 hours. And I think 120 new deaths is still high. With 38,822 new cases with 125 new deaths. And the day before that was 39,394 positive cases and 164 cases. So we're staying in that range of 30,000 with just like between 120 to 160 deaths. So every life matters. Stay safe and let's spread the love and not the virus. And so I think let's just hope that the situation in Hong Kong gets better and they are able to manage whatever's going on in terms of the pandemic.
Thank you very much, Dr. Seshni and Opoku. And I'll see you sometime soon.
Yes.
Have a fantastic day.
You as well. Have a fantastic day and week, and I'll see you soon. And thank you for having me on the show. Love to everyone. Thank you.
Bye for now. Bye.
Bye-bye. Thank you. Thanks, everyone, for joining in.